on 3 drugs. And the reason is, and I will show this in the further slides, is because diabetes is a progressive disease. There's a new class of drugs called GLP inhibitors or GLP-1 analogs. What they're doing is basically they are causing the gut hormones to augment the release of insulin, decrease the hepatic gluconeogenesis or decrease the production of extra glucose from the liver. And then that helps with satiety, improvement in gastric emptying, and that will make us have less energy intake, be able to lose some weight, in addition to watching our diet and to control diabetes. So to summarize, sulfonylureas mainly work on the pancreas to make more insulin. Metformin basically works on the liver to produce less glucose. GLP-1 inhibitors and GLP-1 analogs, what they do is they basically augment the pancreas to produce insulin so that you can have better glucose control. The drugs called Avandia and Actos, they are helping to improve insulin sensitivity. So as a result, the insulin that you're already on or your body is making, it will be more effective and your glucose readings will be lower. There's another class of drugs which is not in this slide, which is the latest class of drugs for type 2 diabetes. They are called the SLGT inhibitors. There was somebody in the audience talking about kidney earlier. This class of drugs, there are 3 that are approved by the FDA, are stopping you from absorbing extra glucose in the urine. So they are increasing glucose urea, but they are improving glucose control. And they are approved in conjunction with metformin and as first-line therapy if there is a problem of allergies or intolerance to other medications. So this is my favorite slide, and this slide is a little complex, but if you bear with me, the problem is that there are several defects in type 2 diabetes. That's not one problem. And the biggest problem is insulin resistance, followed by insulin level, followed by glucagon, incretin effect, and beta cell dysfunction. And if you look to the right side of the slide, that's from the onset of diabetes. But these things are occurring even 5 to 10 to 15 years before diabetes. Now people ask me, how do we not get diabetes? And my answer is, choose your parents well, don't grow old. And we can't do anything about those, but we can do something about lifestyle. So before the onset of diabetes, as we are all aging, we should try to improve our diet, we should try to exercise more, and also try to reduce stress and negative thinking. So that all those things do is they help us to deal with situations better and also be at less risk for type 2 diabetes. So I am going to be in this profession for a long time, and this is the reason for it. There are two major studies that have been done. There are 15 and 20 years of studying people with type 2 diabetes. When patients come to me and say, "Doc, what are you telling me? I was on 1 medication, now I'm on 2 medication, now you're talking insulin? What have I done wrong?" And the problem is that type 2 diabetes is a progressive disease. And both of these studies, the UKPDS, which is the United Kingdom Prospective Diabetes Study, and the study to your right, which is called the ADOPT study, show that initially whatever treatment you give for diabetes, you do better, but over the years you do progressively worse. And you do progressively worse because of those 8 defects in diabetes that work together. So in addition to having to improve your lifestyle, take medications, if you have had diabetes for 30 years, you will be on insulin, because that would be the ultimate thing which will happen. Your body will stop producing and you will be more like type 1 diabetes and not type 2 diabetes. So I don't want you to be pessimistic about it, but because these takes years to develop, but if we can improve our lifestyle and to do better before the onset of diabetes, we don't have very good genetics. A lot of people that I see in the audience have low HDL cholesterol, which is associated with the metabolic syndrome of high triglycerides, impaired glucose. And to combat that, we have to exercise, eat right, portion control, less processed food. In America, we have a problem because we don't get digestive diseases. Our water is too good. A lot of communicable diseases are taken care of here, which are very prevalent back home still. So we have to take the next step, and although we are Asian in genetics, our atmosphere is, or environment is American, so we are still at very high risk, just like Hispanics and African Americans, for developing complications of diabetes. And insurance companies and pharmaceutical companies are investing into diabetes not because they are our friends, but because of the cost. The more we live longer, the more the complications, the more they have to bear with the cost. So with that, I'm going to end this lecture and we'll take questions at the end.
Thank you very much. Such a nice lecture. Now, next one, as I'm myself a speaker today, and before I start, I would like to ask everybody, please take 2 deep breaths and be fresh, okay? I see Malicia gets a time to sleep here, so he's going to be up now. And I see Dr. Maushek, he's sitting there also. But we will start with Mahmoud here. I don't know where is he now. A couple of very important people we are missing. Now my topic will be, you will love it. I just don't go generally about the text, but sometimes I show the videos. Sometimes I make the people feel like you are sitting and you are having this problem directly. So hopefully you will enjoy. Walid is leaving now. Walid? You're going to stay here, right? Okay. This time will come to you also. So, my topic is the old heart with the new colors. Today we are going to see the same heart. There's only one heart, one life, but it changes the colors. Okay. So we, the interventional cardiologists, we pick up the color and then we present and treat the people in different way. That comes with experience. Now, before we start, actually, my pockets are empty. Honestly, I'm not sponsored by any company. I came and paid my everything, and this is just volunteer job. I go everywhere. I go to Pakistan and different countries and give different lectures. I must tell, today I prepared my talk about the ladies, but suddenly they changed my mind. Aga Sahib and other people, they say, hey, since the sequence is diabetes, hypertension, stress, all are related to heart attack, therefore heart attack is important. We are getting old, anybody can have it. So my pocket. Now again, when I talk about the heart attack, again tonight people say, what are you talking about? Heart attack is not again. So I say, what should I tell them? So I show this one. If you have a hammer in your hand, everything look like a nail to you. If you are a interventional cardiologist, you will always think about the coronaries. If you are a hematologist, you will think about the blood disease. If you are a kidney doctor, you will think about the kidney disease. But I wonder, what about the GI specialist? What do you think about whole day? Again, heart attack. Now, we all know that this coronary heart disease is the leading cause of the death in the worldwide. This figure, please, everybody should remember and think about it. He's not your friend, it's your enemy. The most prevalent disease, 30% people die. Again here, epidemiology, 13.2 million have coronary artery disease, 2 billion MI, 185,000 died with the first heart attack, and $133 billion Pakistan's budget we spend on the heart attack. Now, next 10 minutes I'll be very brief and give you to the point. Dr. Mahmoud is here. How you get heart attack? That is the very important point. My talk today to make you understand. You go to the doctors. Doctor doesn't have time to explain. They don't have time to explain their head how you got it, how you get heart attack. If you understand, I can tell you, you will save this disease. And second thing is why you get it, heart attack, and what to do. Very briefly, I'll tell you. Now, how you get heart attack? Now, everybody think about the brain, knees, bones, kidneys, gut. Nobody thinks about this important organ in our body. This is one of the most important organ in the body. What is that? inner lining of the heart blood vessels. It is so important, runs from head to toe, that you don't believe that. If you maintain its integrity, it's going to be your friend. If you're going to disrupt its integrity, it's going to be your enemy, it's going to bite you back in different forms, by heart attack, by stroke, by kidney disease, by peripheral disease, finally you will die. So the purpose is today to take home message to maintain the integrity of this important organ, and I can tell you, this is the largest organ in area-wise in our body. If you peel out the inner lining of the blood vessel and spread on the floor, it is exactly the 5 size of the table tennis court. Is the liver big? No, it's the largest organ. It has very important functions. What are those? It acts as an antithrombotic. It prevents the formation of the blood clots. It inhibits the platelets activity. It really maintains the blood fluidity. So it is a so slippery organ. If you maintain the integrity, I tell you, it's going to be your friend. I remember I was in 3rd year, slippery action, I can tell you. We were doing a juris